Services and Support in Toronto with CNIB's Sue Marsh-Woods. I'm Lori Lyons, and I'm the Scientific Information Manager at the Foundation Fighting Blindness. And Sue is the Services and Operations Manager at the CNIB, Toronto Region Office. She's worked for the CNIB for 27 years. Sue is one of the founding members of the Vision Quest Conference and is passionate about the work of the FFB and the CNIB. Today, Sue will share with us where to find services and support in Toronto. Please welcome Sue Marsh-Woods.
Thank you. Well, it's really a pleasure to be here. This is my favorite conference, and yeah, I was one of the founding members going back to, it seems like a long time ago, 94. I was only 5, but anyway. So anybody who is experiencing difficulty with vision that's impacting you in some way can actually self-refer to the CNIB, and we have a 1-800 number now that's staffed by a call center, of which some of the folks who work there are visually impaired, and we think that's really important. And so basically they can connect you to your home office, so depending on where you live, you'd be directly connected. And all we really need to get things going is your name, your address, your telephone number, and your date of birth. If you're calling for someone else, we obviously would need to know that they have consented to be referred. And from there, the first step is doing an intake assessment, and it is done on the phone. And we feel that the phone assessment, while not the most intimate in the sense, it allows people to get into service quickly. So, if we were doing in-house or in-person intakes, it could take quite a bit longer to get into the service provisions. So we have a standard series of questions that basically is designed to, it's very holistic. We don't just focus on vision. We look at someone's hearing. We look at general health, support systems, because these are all really important factors that come into play when you're first learning to adapt to living with vision loss. So once the intake is done, we would identify with the individual what services they feel would best meet their needs. So we don't drive it, you do, based on what we tell you about what we offer. And then from there, the referrals get made to our direct service staff. And again, I'm going to speak for Toronto, but in Toronto, we try to contact people within 2 weeks of that initial phone call for just to let you know what the service is all about, and probably more importantly, to ensure that you're not in a situation that requires immediate attention. So, for example, if someone was living alone and they've reported that they've either had a fall or they've, had a mishap in the kitchen, we would try to get out to see that person quickly. And, fortunately, it's not the vast majority of people who are in that circumstance. So I guess the other thing is the misconception that people think when they hear CNIB, they equal that to you must be blind or you must have really serious vision loss. And that is not the case. Less than 10% of our clients are totally blind or really severe vision loss. The remaining 90% have varying degrees. And some people have pretty good vision, but they're living with a diagnosis of whatever it is, AMD. And sometimes I think it's helpful to know what's out there should things change. And so we try really hard to get the word out that don't wait until you're struggling, because we can do a lot more with magnifiers, for example, earlier on. So that's the intake process. It pretty well exists like that right across Canada, that you expect it's a phone call. So in terms of services, I'll describe each one again as briefly as I can. Low vision is probably the most commonly used service. That's where we're actually trying to maximize whatever remaining vision you have. So you would come in for an assessment, and we test the vision near and far, and then recommend low vision devices that would help to enhance vision. And if somebody decides they may want to pursue reading glasses, and this is sometimes the case, we don't do reading glasses, but we have a couple of low vision optometrists who come into the CNIB a couple times a month, and so we run clinics, and so people can get either the sunwear, the Corning glasses, etc. There is a program. Some of you may be aware of it through the Ministry of Health, so through your health card. It's called the Assistive Devices Program. And we're very, very fortunate in Ontario to have this program because many other provinces have no other funding. And so some of the devices can get a little pricey. They'll cover up to 75% of the cost of a device that's, covered within the stream of devices. So you've got a category for reading devices, of which are allowed so many in a 5-year period. So it's, there are hoops and loops to jump through, but, certainly it's well worth it when you're getting some money back. And another category would be writing. So that would be a computer, possibly, for somebody, closed-circuit television, and then a daisy player, which plays the audiobooks. Actually, that's under the reading category, sorry. And then you can get a white cane, a mobility cane, once a year through that program. And again, you would have to come in or call in, however you want to do it, because we do need signatures on the form that the Ministry of Health. The other thing we need is an updated referral from your eye care physician. So while you don't need that medical referral to begin the process, we do strongly encourage people to get in touch with their eye care physician to have a referral sent in, because we don't actually assess someone's level of vision, and there are different categories and different services that one may access depending on vision level, and ADP is one of those. Your vision has to be 20/70 after correction in both eyes, or have a fairly severe restricted visual field. So again, we rely on the eye care doctors to provide that. So low vision, again, is really, really important, and it helps people to access information. We have independent living skills staff who are focusing on enhancing skills in daily living. So anything you can think of in the home, from turning the stove on to preparing meals to organizing your kitchen to organizing your communication, whether it be, writing a grocery list, to anything you can imagine, how to dial a phone, organizing recipes, on and on. And basically they will come into your home and try to figure out what are your main concerns, and then they offer you tips and tricks and gadgets and some counseling along the way. We integrate our counseling into all of our services. And if somebody is, looking like they're into clinical depression, we will strongly urge them to access counseling through a family doctor, because we don't have really the skills to be able to obviously diagnose and treat. But we can certainly provide peer counseling to anyone who really is struggling, and that's really, really, I think, one of the most important things that we do for people. The Orientation and Mobility Program is addressing travel in any given environment, and usually our first line of attack is to figure out what do you want to do, what can't you do, and then figure out how do you see the world. What influences your vision? Is it lighting? And then we look at whether a white cane is something you need to think about. And that's kind of a dirty word, unfortunately, by many people are really put off by the idea. And I completely understand it. It's, you feel like you're suddenly going to stand out, and perhaps you will, but sometimes we have to get to that point where you realize that you've got an invisible disability, really, and if you are tripping, falling, unable to see a bus sign, for example, you may want to think about that. But, there are other solutions, sunglasses to cut glare and on and on. So the mobility person would really be developing a tailored program to meet your specific needs, and you could come in and do some mobility training and then go away and come back a year later because your vision has changed. So it's not sort of a beginning and end. It's a constant kind of coming back through, particularly for people that have RP and are experiencing more loss in vision. So and that's actually the service that I did for many years before I moved into a management role. So we have a regional assessment center where we conduct high-tech assessments. So this would be if you were interested in a computer closed-circuit television, and we have consultants that would do that assessment and then assist you with completing the paperwork in order to get the funding from, again, through the Assistive Devices program. And so at the CNIB on Bayview, we do have 2 consultants who do that particular function, and it's a pretty busy service because more and more people are, of course, using computers, and we certainly encourage that. Before someone can access a computer, we do have to ensure that you know how to type. So sometimes that's not always the case. A lot of people, when they did type, they were what we call hunt and peck typers, and you really can't do it that way when you're using assistive devices, either speech or large print. You really need to be able to navigate that keyboard in a good systemic way. And because we know that, we offer keyboarding classes, and we run groups, and we have individualized keyboarding classes. We're fortunate in Toronto because we have the facilities to run a group for up to 10 students at a time, and we have some amazing volunteers who come in and help us to run that program. And it runs for about 2-3 weeks, so it's pretty intense. But the whole idea is when you master that skill, then you can go on and get your computer and then have access to email, the internet. I think one of our eldest clients who went on to get a computer was 91. So we taught her how to type, and then she went on to get a computer. And you might wonder why would she want to do that, but it came down to all of her grandchildren were not living in Toronto, and she really wanted to be able to communicate with them. And so she's emailing them, and so we are finding more and more older folk are going into technology, and so it's pretty important. We have a terrific library, audiobooks that are on CD, and we have descriptive movies that you can get, the capacity to download all kinds of electronic material, newspapers, research publications, and again, it's a really important service. It's keeping people connected, and the library service is free. The only catch, if you like, is the audio books are formatted on a DAISY format, and the machine, or the player rather, is it's called a Stratus. That's the newest version of it. And again, the Ministry of Health will cover part of the cost. And so if you haven't used your funding for a CCTV or the reading machine, you could get a DAISY player, and they're about $118 with funding. And, again, for some people, the library is virtually their lifeline. So, it's expensive, but unfortunately, it's like supply and demand, and the technology is really specialized. We do not sell any of these products, the high-tech products. We connect people to the vendor in the community, of which there are many. We don't pick one over another. What we do is give you a list, and then you can go and shop, and you've got all of your paperwork to give you the funding. So the CCTVs come from the University of Waterloo, and they're on a 5-year lease. And again, the CCTV, again, for many people, they couldn't live without it. It's, one lady, actually, her machine just broke, and she's 92, and she's desperate because she does her crossword every morning. And so what we're trying to do for her is get her a loaner until we can get her in for another assessment. So final service is our store, and we call it Shop CNIB, and we have a store that's fully operational, and you can buy things, etc., at our Bayview location. And we sell over 1,000 different products that can be very beneficial. And we also have an online option. So if you couldn't come in, there is catalogs actually at the CNIB display, or you can go online and have a look at what we've got. So those are the services that are run primarily by staff. We have a lot of things we do with volunteers, and I really want to take a few minutes to talk about that. We run peer support groups. We call our peer support groups New Beginnings, and it's an 8-week program, so you come in for a couple of hours over the 8 weeks, and all of our leaders are volunteers who are living with vision loss, and we have about 12 right now in Toronto, and they're running groups all across the city. And basically, every week we talk about a different service, and the people in the group get a chance to ask questions. They get to commiserate, they get to laugh, they get to cry, do whatever they need to do. But I think it really helps to minimize isolation that people often feel. Oftentimes, even family don't really understand what you're going through, and so we encourage family members to attend as well, because it's an adjustment for everybody. It's not just the person that's experiencing the vision loss. It's everyone else around you that needs to kind of get a sensitivity to, don't move things out of their place and all those good things. So I can't say enough about the groups. To me, it's one of the best things we do, and yet the cost is minimal because it's primarily volunteers that are running them. So again, if anyone here is interested in joining a group, do let us know. That's the CNIB services in a nutshell. I should mention one more thing. Relating to volunteers, we have developed a new program in the last couple of years called Vision Mate. And a Vision Mate is what we used to call a friendly visitor. And so we have a lot of people who are isolated. They may not have a lot of family and friends, and they want to get out. So we are working really hard to recruit Vision Mates for folks who are in that situation, and so they can maybe go out once a week, go for a walk, sit and have coffee, whatever it is the person feels they need to do. So if you know anyone that is interested in being a Vision Mate, we're always looking for volunteers. And also within the CNIB building, we have lots of really cool volunteer opportunities. And again, whether it's sitting on a board or answering our phones to helping us in the store. And something very exciting we've just started about 8 months ago is we have a kiosk set up at the eye clinic at St. Michael's Hospital downtown on Queen Street. And the idea is to reach out to patients that are there for hours waiting for their eye doctor. I'm sure you've all been there. And it's amazing how many people don't know what CNIB is. That's one of the first things we'll ask, and we're actually keeping stats on the number of people who say, I don't know what CNIB is, or they may just not understand that, we work with people with low vision as well as people who are blind. And so for us, we're trying to encourage early referral, so that's really our number one objective. But what we're finding is that it's simple awareness is really what we're finding it needs to be done. And then once someone's aware, and hopefully they understand that we're not a terrible place, because oftentimes the eye doctor will say, well, there's nothing more I can do for you. It's really bad. You're going to have to go to CNIB now. Really sorry. We don't really want people to think of us as, the end of the road. We want to be in partnership with the eye care community to again, get in there early. We may only do a few things, but again, I've met too many people who struggled with either diabetic retinopathy, where they'd have days where they couldn't see a thing, and then their vision would improve. And they're really left feeling pretty helpless. And, we know that the incidence of depression can be pretty severe, and we really want to make sure that we're doing everything we can to mitigate that And, of course, falls is another huge issue with people going into the ERs and the hospitals. Costs a lot of money for the healthcare system, and it's unnecessary. If we can get in and, assess the home and make it safer, then hopefully we're preventing, an unnecessary injury. So that's CNIB. So before I go on, I'm just wondering if there are any questions.
In Toronto, some of the crosswalks are equipped with audible signals. I have low vision, and I have trouble distinguishing what direction I should go in. Is the CNIB affiliated with that at all?
Yes, we are. We've worked with the City of Toronto on the development of the audio pedestrian signals over a number of years. I was actually involved in that when it first all started, and there was a lot of controversy about whether we'd have tweets or chirps or buzzes or beeps. So, yeah, absolutely. And when we're teaching folks to navigate, whether they're a low vision person or not, we integrate that into our teaching. So it is a good directional tool. However, we wouldn't want you to just rely on that because, part of getting around independently is knowing where you're going. So planning ahead of time so that you know what your directions are, what are your landmarks. But yeah, if you haven't had any mobility and you think you need it, let me know. We could set you up. And it doesn't, it could be a couple of lessons. We've worked with TTC on making the subways accessible, the yellow platform edge. And currently we're working with the City of Toronto on tactile warning signals at curb edges. We currently don't have this in Toronto, but a lot of cities around the world have various systems. Advocacy is a huge part of the work CNIB does, as well as public education.
What kind of support groups and stuff do you have for children?
So we have, and I apologize for not mentioning that, don't tell my staff, but we have an early intervention program that is for children birth to school-aged, and the name implies early intervention because when you've got an infant that has either limited vision or no vision, we have to get in there early to be able to stimulate the other senses because about 80% of development is through vision. And if you don't, teach the parent how to play purposefully with that child and say all the right things to that infant, development's going to be delayed anyway. And so they will actually go in and work with the parent and the child. And the idea is the parent has to become an expert, and they do. Who better? They're with the child, 24/7. Once kids are in school, whether it's in their own local school or there is a school in Brantford, W. Ross Macdonald, they would be supported by vision itinerant teachers who are teachers who teach, the academics. And if the child cannot see well enough to use print, they're going to be a Braille reader, then they would learn Braille along with their sighted peers. We offer after-school programs in Toronto because the school board in Toronto has their own mobility specialists because it's such a huge board. During the month of March, during March break, CNIB turns into a March break camp for children and teens. And we've been running camps now for, I believe we're into our 7th year. And this last March break, we had 35 kids in the varying age groups. And really, it's a fun camp, but it's purposeful learning. So we're teaching them everything from socialization. And I think our kids, because they are primarily integrated, don't see a lot of other blind kids. And so it's unbelievable the synergy and the connection the kids make. They make friends. They exchange phone numbers. They're bouncing around the room. They're bouncing off the walls. And it's amazing. It's magic, really. And, I wish we could do more, but unfortunately they're in school. So they'd have to play hooky to come to our camp. And then we do a summer program as well. And we're now starting to get into leadership and pre-employment for teens because, again, for our kids, they're not getting the same exposure that sighted kids are getting. They're not getting the job at McDonald's or wherever kids work these days. And so we really encourage the parents to tap into babysitting jobs because, work doesn't begin when you're 18. It starts when you're much younger. And again, because so much of it is visual, so much socialization is visual that we can't take for granted that they're picking up on the nuances. So we're expanding all the time, and we now actually have funding built in that the kids are provided with transportation to CNIB for the program, and that's made a huge difference because a lot of our kids are coming from families that are living well below the poverty line and don't even own a car, and they might have, several kids that they're trying to somehow look after, and, so it's, Does that answer your question? Great. All right. I think we have to stop now.
As always, I get to be the evil one that cuts everyone off. So thank you, Sue, so much for sharing your knowledge with us today, and thanks to all of you for all of your questions.